Good morning, everyone, and welcome to the last meeting of the year for our GDDS user group. Thank you for joining this morning. As a reminder, if you would please keep your microphones on mute to avoid any background noise, but also feel free to unmute and ask any questions or give feedback at any time. This is an open forum meeting. We also have the chat function available if you would like to utilize that as well. And I believe we've got about everybody in. We'll go on and get started. Got Bill Wiley and Sharifa Nabos joining us from GHA, and I am Leslie Stanovich, and this is the data services team. This morning, we're just going to give our GDDS overview. We have a few updates regarding the data refresh. We have some member reports that Bill's going to cover, and then we have some trivia that we might throw in there at the end. And then we have want to review our 2023 goals and our schedule. So as always, I like to give an overview in case, as a reminder, and in case we have new users. The GDDS program is the Georgia Discharge Data System, where you hospitals submit your data in the UB04 billing format to our vendor, Heidi, and that data is processed, it is validated in GO codes and DRG codes, and service lines are added to that data, and it becomes the Georgia Discharge Data System. And then that data is made available to you through the Advantage Optics tool, also made available to those who subscribe to the limited data set. And then we also submit that to the Brain and Spinal Trust Fund Commission, the state of Georgia, on your behalf. And we also utilize, as far as a research, quote unquote, arm, the Agency for Healthcare and Quality and their Healthcare Cost and Utilization Project. They receive all research data requests and vet those according to specifications that we have agreed on. Requesters have to sign a data use agreement, and then those requests not only are vetted through AHRQ, but they are sent to GHA for an additional approval before any de-identified data is released to the researcher. Any questions on the flow of our GDDS program? All right. Updates for the Georgia Discharge Data System. We will have a refresh beginning of next week, which will be the Q3 2022 data refresh. As a reminder, we do monthly refreshes, and then we do a full quarter refresh once that quarter has been closed. As a reminder, you can always resubmit data for the discharge year that is currently open, which is 2022. So, constantly be reviewing your data, and if you notice anomalies or things that need to be corrected, that data can be corrected all the way up until July of 2023. So the Advantage Optics and the limited data set is a snapshot in time, so to speak. And one thing I wanted to kind of link in with that is, now that we've been using Advantage Optics for not quite a year, but almost a year, we realized, one of our users brought to our attention that some of the data was not quite aligned for the 2021 data. We hadn't had to address this before, but as you know, we close out the prior year and we don't release any more data for the limited data set at the end of July, beginning of August. And we didn't really have those processes aligned for the data update and the limited data set and the data update for Advantage Optics. So there will be a refresh of the 2021 data in Advantage Optics when the Q3 2022 data is updated. And that will, moving forward, will keep the data more aligned. We will also be, you should have received your GDDS 2023 notice, and we will be sending out invoices mid to late January. Bill, do you have anything you want to add to that?
Just want to remind everyone that we usually do this based on 10 tiers of inpatient volume and AMSurge, but we're freezing the tiers as of 2019 data, just because of the crazy impact of COVID. So we'll reanalyze that at the end of next year and determine if we should start using 2022 data. But your tiers are based on 2019.
Thanks, Bill. Sharifa, you want to go over our schedule for us?
Yes. Good morning, everyone. Yeah, the year is over. It seems like it went by so fast. And as you know, October data will be due this month, so on the 15th, as we're following our monthly submission schedule. And thank you to everyone who's been submitting on time or letting me know if they're having issues submitting. We were able to close the quarter three data set this week, so it should be available next week for you on the strategic planning tool. And this has been I feel like it's been a good year. I haven't had too many issues with data submissions, and the people who've had problems have been communicating with me pretty consistently, and I appreciate that. And please continue to do so when you're having issues submitting, or there was a lot of also transition to new EMR. So Epic was a big one that people were transitioning to. So people who were going live either in August, October, or November, we've been able to get their test files submitted and help them along the way. So if you have any of that coming up, also please let me know. If you have any transitions of EMR systems, it's always good for us to know in advance, and then we can kind of plan ahead. And we'll be sending out our annual survey in January to ask you, if you have any plans on switching or if there's anything changing in your system. So please look out for that. And also, let us know if you want to add any users to our either the HeidiNet tool, which is the submission portal, or the strategic planning tool. If you have anybody you want to remove, anyone retiring or moving positions or leaving the organization, we always like to know these things too, so that we can keep our user list fresh when we send you emails. So please continue to do that. And if you have any questions about that, let me know. And and so this is the 2023 submission schedule, same as last year or this year. The data will be due 45 days after the month is over. And again, thank you for your cooperation and your diligence in submitting the data. And did you want to add something to that, Leslie? I wasn't sure.
Yeah, we wanted to just kind of get a feel for when you normally submit your data. So I'm going to launch a poll here. If you'll take just a minute to make a selection. Let's see. Can you see the poll?
Yes.
Okay. I know some of you are just on the phone and may not be able to participate. All right, I think everybody's that is going to respond has responded. So here are the results. Can you see the results?
Yep, sure can.
I can't always see when I launch the poll. So we appreciate, I know Sharifa really appreciates that people, those of you who submit on the 15th or prior to the 15th, and by doing so, you give yourselves the opportunity to have a little more time to review. We realize that you may not be ready to submit before the 15th, which is understandable due to coding issues and those being completed. And even if you lag behind a little bit, I know Sharifa works with you. If you have an issue, always communicate that to her, because we are flexible in working with facilities. So thank you for that. We just thought it'd be fun to get a feel for what people's normal submission schedule is.
And I wanted to add too, sometimes, the 15th will fall on a Saturday or a Sunday. And so we do, have some wiggle room when it comes to that. Usually I don't start contacting people until maybe like the 18th or the 19th. That's usually my first email that I send. So I see that people do submit between, the 15th and the 17th. And so that kind of gives me an idea of when I should start harassing you. But I'm trying not to do that. I'm trying to wait and be patient because I do understand that sometimes it's one person doing the work, there's not that many, or, you forget or whatever. So these emails are just reminders to submit the data. And then by that next week, usually we like to close and refresh the database so that it can be available on the tool.
And as a reminder, it's always good. We encourage you to have a backup. We know things happen where you may be suddenly out of the hospital and may not be able to submit the data. So it's always good to have a backup person. Great. Any questions about submission schedule? All right. Then I'm going to ask Bill to give us an update on member reports that have been posted.
Thanks, Leslie. Yeah, we posted 4 member reports to the folders last week and into this week. The first is the Critical Access Hospital and Small Rural Utilization Analysis. A lot of y'all may remember that called the Critical Access Hospital Data Book. It just shows critical access hospitals and small rural volumes in comparison to benchmarks across the nation. The other one that we posted was the cost report model, which is the Q2 data. So basically it takes the entire cost report that's been published, and what I would do is just go through and look at that and make sure that what has been published and publicly available is what was submitted. Obviously that goes into things like wage index and stuff. So, that all of the different worksheets are in that report. The last one was the OPPS final rule. I don't think there was a whole lot of changes between that and the proposed rule, but that has been posted. And then lastly, in their quality folders is the readmission reduction program. That's based on your Q3 2022 projections. Coming up in Q1, obviously there's not a whole lot of proposed rules that are being posted then. So it's a lot more of the quality reports and kind of some of the more popular community reports. So, the enacted Medicare cuts analysis will come in. That shows like a trend line of all of the different cuts that you have been facing. It's great for the business community and people like that. Just going to read out some of the other ones that are coming in. The Medicare Quality Program Performance Summary, and that's a one-pager. Medicare's beneficiary spend or spend per beneficiary, value-based purchasing impacts, the quality measure tools, wage index, and occupational mix. That'll come out in February. And then some of the Medicare margins analysis. So the first quarter will be busy, but it will be more on the retrospective analysis and things like that. But we'll post those as soon as we get them, and we'll let everybody know via this as well as an email, and post them into your member folders.
Great. Any questions for Bill? And as a reminder, the C-suite and usually the marketing staff have access to the member reports. If you're and usually quality directors, if you do not have access to this and would like access, we just need an email from a C-level to say we would like this employee to have access to these member reports. They are located on the GHA.org website under data services and then member reports. So you do have to log into the GHA website to access these reports. And you can contact myself or Sharifa if you have any questions about access.
And there's no PHI or anything like that in these reports. It's just custom to your facility. That's the only reason we put them in with some sort of a access control.
Right. Great. All right. 2023 is upon us. And we went over these last month, but our goals are, we're working with Heidi on developing some potential quality reporting called their suite of tools called Care Optics. So that would include some of the hospital acquired condition reporting, potentially readmission reporting. So just be on the lookout for that. We'll obviously have more information in our user group as those are developed. We are hoping to have an in-person meeting at our new offices at GHA. We're exploring purchasing some additional outpatient data that would supplement and enhance our outpatient data and potentially grab some of those freestanding ambulatory surgery center services. So that's going to be a pretty heavy lift for Heidi and for us. So we'll be working on that and giving you updates as we move along. Exploration of financial and workforce data. We're working on data collection, and then also enhancement of the HeidiNet reports, where the HeidiNet reports are mostly static at this point, PDFs. There is a Excel file verification report that you can download, but we're working on enhancing the interface of those reports to potentially have some graphics, move some of those into the Tableau base so that you're able to review your data at a different level. We also, Heidi reached out to me yesterday to let me know that they are working on a new set of reports that should be released the first quarter of next year. And those would be more predefined, what they worded as board type reports for hospitals. So stay tuned for that. I'm just going to leave that as a teaser there. And as we get more information and as those are available, we will, obviously do demonstrations and give instructions on how to use those reports. Any questions? Last month, we talked about, and everybody seemed to agree with moving to a new format for our 2023 meetings. And so I had tentative here before, but now this is what the schedule we're moving to. So for quarter one, we won't meet as a user group until March the 1st. However, we will have an office hour on January the 4th, and that will be a time where if you have any questions at all regarding Advantage updates, regarding data submission, regarding the GDDS program at all, Sharifa, Bill, and I will be online for the entire hour from 10 to 11 to field any of those questions. So we will be sending out a new office hour link for January, April, July, and October. And then we'll also be sending out a new user group invitation for March, June, September, and December 6th so that you can go in and add those to your calendar. And we'll do that after Christmas. So be on the lookout for that. And then those middle months will be devoted to scheduling data and technology meetings. Now we wanted to try to do something fun just to wrap up the year. And so I have another trivia question for you that I'm going to launch. So what year was Home Alone released? All right, I'm going to end it. I'm going to share the results. So most of you said 1990, and the correct answer is 1990. Awesome. All right, got another one for you. What year was Christmas Vacation released? We're trusting you're not Googling this.
This one should have been a national holiday.
And we streamed it. I don't think I've seen that movie, Bill. I know it's your favorite one. I didn't want to say earlier. Is it on Netflix?
No, it's on almost every night on television, actually, depending on what. Okay, so I did not proof my poll. So actually the correct answer is not up there because the correct answer is 1989. So those of you that answered 98 or 90 will give you credit because you were very close. Sorry about that. This was a last minute add to this morning. All right, last one. What year was Polar Express released? All right, I'm going to end it. The majority said 2004, and the correct answer is 2004. All right, this is the last trivia or polling question. I want to know, out of those movies, what was your favorite?
There better only be one answer to this one.
Be interesting to see. I'm gonna give it a few more seconds.
Home Alone is winning. Ooh, it's close.
It is very close.
We can probably back into people's age ranges based on which one they say is their favorite movie.
All right, I'm gonna end it.
Yes.
Home Alone edged Christmas Vacation by one person.
I should have voted.
I take both. I would have voted for it.
All right. Thank you guys for playing along. We just wanted to kind of end the year on a light note. Does anyone have any questions or feedback for us? Well, we appreciate your participation, your feedback, and we want to encourage anytime you have a question about data, a concern, please bring it to our attention. You know, sometimes we miss things, and we had a case this past week where somebody brought something to our attention, and again, we were able to, you know, take it to Heidi, and we're working on a resolution. So we appreciate your feedback, and don't ever hesitate to ask a question or bring something to our attention if you feel like that something's not quite right or doesn't look right to you. We're happy to look into that with you and see if we can find an answer. Here's our contact information. We're always available. Please reach out, and we hope that everyone does have a happy holidays, Merry Christmas, and everyone stay safe.